Good morning. It's March 9th, and this is your daily brief in science. Here's everything you need to know. ELMO 2025 ran across November 2025 in multiple countries and regions, with events in schools, learning centers, and community venues to test arithmetic, logical reasoning, and problem-solving skills. The competition redesigned its structure in 2025 to emphasize problem-solving and critical thinking, aligning with iLevel's view that mathematics should foster reasoning and creativity beyond speed and memorization, and participants received detailed result reports to aid learning growth. Official results were announced at the start of the new year, with award ceremonies already held in the Philippines and Thailand, and plans for additional ceremonies in March 2026 in other participating countries. A supporting event photo is available through PR Newswire. Participants received detailed result reports to help students and parents understand learning strengths and guide future academic growth. The article features a linked photo showing students and award recipients celebrating at ELMO 2025. Medals were awarded to all participants, reinforcing the event as a milestone and encouraging a culture of challenge, resilience, and curiosity under the banner, "One Test, 1,000 Possibilities." The unifying theme for ELMO 2025 was "One Test, 1,000 Possibilities," highlighting the value of challenge, confidence, resilience, and curiosity in learning, with medals for all participants. All participants received medals to commemorate their effort and mark the Olympiad as a meaningful academic milestone. iLevel positions itself as a global education brand that strengthens mathematical foundations and critical thinking through its iLevel Math Olympiad and related initiatives. A new study uses artificial intelligence to read breast artery calcifications on routine mammograms to predict future cardiovascular risk in women without known heart disease. The researchers say breast arterial calcification, or BAC, is a strong biomarker that could be identified during cancer screening and used to flag heart risk, including in women under 50, who are often considered lower risk. They urge standardizing BAC as an actionable cardiovascular biomarker, so cancer screening platforms can also support heart health management. Clinicians could use BAC findings to prompt preventive steps like cholesterol testing or initiating preventive medications, and policymakers might consider program-wide adoption without extra infrastructure. The study drew on a diverse cohort across racial and ethnic groups and two major United States health systems, strengthening the robustness and generalizability of the results. Future work includes clinical trials to operationalize AI-backed protocols, notification workflows, ethics, and ensuring equitable access. Nishtha Sareen, Maryland, MPH, emphasizes prioritizing heart health and staying aware of risk factors, including getting tested. An editorial accompanying the study advocates leveraging high mammography adherence to raise cardiovascular risk awareness and formalize BAC as a routine measure in preventive care. BAC was quantified by AI and categorized into 4 levels: no BAC, mild BAC, moderate BAC, and severe BAC, defined as 0 to 10 square millimeters, 10 to 25 square millimeters, and over 25 square millimeters respectively. Key risk factors to monitor include blood pressure, cholesterol, and body mass index, with special attention to perimenopausal women due to rising cardiovascular risk. The approach could trigger preventive actions such as cholesterol testing and consideration of preventive medications, addressing underdiagnosis of cardiovascular disease in women. Findings held across races and persisted after adjusting for standard risk factors, suggesting BAC from mammograms could inform both patient awareness and clinical decision-making for cardiovascular prevention. New Zealand faces a 9th wave of COVID-19 as experts warn waning population immunity is allowing the virus to regain ground. A NZ Doctor News report highlights calls for action to blunt the pandemic's impact, including stronger vaccination and surveillance. Public health expert Michael Baker says New Zealand isn't adequately tracking long COVID and proposes periodic surveys to quantify its prevalence and impact. Immunity gaps are attributed to low booster uptake and the time elapsed since many infections, giving the virus room to reassert itself. Wastewater surveillance and hospitalization data point to a substantial current wave, with wastewater levels at their highest in more than 6 months. COVID-19 remains the country's most impactful infectious disease, contributing to hospital occupancy with an estimated toll of about 1,000 deaths per year. Officials and experts urge people to get boosted, isolate with symptoms, and support improved long COVID surveillance to mitigate the ongoing burden. The Royal Commission of Inquiry into NZ's COVID-19 response is due to publish final findings soon, expected to influence future public health planning as the virus stays active. Professor Baker notes waves have occurred about twice yearly since Omicron, but this wave is not driven by a new subvariant and likely reflects waning immunity. Preventive actions include following vaccination guidance, maintaining infection control, and staying alert to changing public health guidance. The report targets health professionals, outlining how frontline providers should respond to evolving immunity patterns and variant activity. A Christchurch incident around Electric Avenue is noted, with transmission linked to indoor settings and gatherings surrounding outdoor events. The article emphasizes ongoing concerns about resurgence and the need for continued vigilance in public health measures and personal protection. The Destiny Breast 05 trial shows Enhertu delivering a meaningful reduction in invasive disease recurrence or death versus TDM1, with a 53% lower risk and a 3-year IDFS of 92.4% compared with 83.7%. The Phase 3 study enrolled 1,635 patients across multiple regions, focusing on individuals with high-risk residual disease after neoadjuvant therapy for post-neoadjuvant Enhertu treatment. Safety aligned with Enhertu's known profile, with similar Grade 3+ treatment-emergent adverse events to TDM1, including neutropenia and decreases in neutrophils, white blood cells, and platelets, and a higher ILD pneumonitis incidence in the Enhertu arm. The SBLA is evaluated under Project Orbis to enable concurrent international review, accelerating access to effective cancer therapies, allowing simultaneous submissions and reviews across participating regions. Subgroup analyses showed consistent results across pre-specified groups, with safety considerations noting ILD pneumonitis and left ventricular dysfunction and ongoing monitoring recommendations. Regulatory submissions for Enhertu based on Destiny Breast 05 are under review in the European Union and Japan, with an additional US SBLA for THP after neoadjuvant therapy tied to Destiny Breast 11 results and a May 18, 2026 PDOFA date. European Union and Japan reviews continue, supported by the broader Destiny program across multiple trials. Safety findings were in line with Enhertu's established profile, with no new safety concerns identified. Enhertu has received FDA priority review for adults with HER2-positive breast cancer with residual disease after neoadjuvant therapy, signaling potential earlier approval in the post-neoadjuvant setting, and breakthrough therapy designation was granted in December 2025 based on Destiny Breast 05. Enhertu is a HER2-directed antibody-drug conjugate, DXd, developed by Daiichi Sankyo and co-developed with AstraZeneca for commercial use. Destiny Breast 05's primary endpoint is investigator-assessed IDFS, with secondary endpoints including DFS, overall survival, DRFI, BMFI, and safety. Investigators reported consistent benefits across pre-specified subgroups. A new study links stress during and after pregnancy to higher long-term blood pressure, but only for women who had adverse pregnancy outcomes. Across 3,322 first-time mothers, higher perceived stress was associated with greater risk of elevated blood pressure 2 to 7 years after delivery, highlighting a specific subgroup at greater cardiovascular risk. Data from the PNEUMO-M2B study, published in Hypertension, shows the cohort averaged 27 years old and included 17 centers in 8 states with diverse demographics, 66% white, 14% Hispanic, and 11% Black. Among those with adverse outcomes, moderate to high stress correlated with younger age around 25 to 27, higher body mass index, and lower education, suggesting these factors may amplify stress-related cardiovascular effects. The findings point to social determinants of health as influential in postpartum cardiovascular risk and stress trajectories. Clinically, the study argues for incorporating stress assessment and management into postpartum care, especially for women with adverse pregnancy histories. The authors call for interdisciplinary collaboration across obstetrics, cardiology, psychology, and public health to create risk stratification and holistic postpartum interventions, with stress management identified as a modifiable determinant of long-term hypertension risk. Limitations include reliance on self-reported stress, absence of second trimester stress data, and a cohort limited to first pregnancies, pointing to areas for future research. Additional caveats include potential unmeasured mood or physical symptoms affecting stress reports, and the need to explore more stress components and different adverse outcome combinations. Importantly, the risk persists from pregnancy into early adulthood, underscoring the potential for primary prevention through stress reduction interventions. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.